Um, thank you for coming to the webinar today. So today's webinar is all about assistive technology to help you in the home, and I'll go through a bit more about that as we go through the presentation. Um, Perfect. So I just want to begin today by acknowledging the traditional custodians of the land on which we gather today and pay my respects to their elders, past and present. I extend that respect to Aboriginal and Torres Strait Islander people here today. So I'm going to just go through the agenda for today's webinar. Um, so I'm going to talk about how we can help you achieve your goals. I'm going to go through some equipment which can support you at home and help you to increase your independence at home. At the end of the webinar, I'll provide details of next week's webinar, and there'll be lots of time for questions at the end. Fine. Um, okay. So, how can we work with you? So the aim of this webinar is to identify the types of equipment which could support you to live at home and promote independence in the community. So I'll just introduce myself first as well. So my name is Emma. I'm an occupational therapist here with Empower. And as an occupational therapist, my main role is to help you to live as independently as you can at home and help you with activities in your daily routine which you're finding difficult at the moment. So the aim of this webinar is to show you a range of the equipment that is on offer, which can support you to increase your independence and achieve your goals. This equipment is often referred to under the umbrella term assistive technology, which some of you may have heard before, but it just basically means that it's just pieces of equipment which can make different activities or tasks easier and easier for you and increase your independence with them. And I will go through some of this in equipment and explain how they might support you to live independently at home. And some of the equipment that I go through today is only some equipment that is available. There is a wide range of equipment that can help you to increase your independence in your activities. Okay. Fine. So first of all, I'll go through toileting aids. So sometimes people can have difficulty with getting on and off of the toilet, and there is some equipment which can help to improve this and make it easier for you and increase your safety doing this as well. So for example, if you need support to push up to stand up from the toilet, there is pieces of equipment called a toilet surround, which is the first picture here. And it basically just sits easily around the toilet and has arms either side, which you can push up from to stand up and to make that a little bit easier for you. Some people then have difficulty getting on and off of the toilet because they find that the toilet is a little bit too low for them. So what we can do is we can fit something which is called a toilet seat raiser over the toilet, and it just increases the height of the toilet to make getting on and off the toilet easier. And then for some people, they may need both. They may need the toilet to be raised slightly, and they also might need arms either side to help them get on and off the toilet. And that would be the piece of equipment, which is the middle picture, called a toilet or an over toilet aid. So that helps by increasing the height of the toilet, but also giving you the arms either side to help you on and off of the toilet. Um, Perfect. Then there's like some bathing aids. So for some equipment that is helpful in the shower or in the bath to increase your showering and increase your transfers in and out of the bath. So first of all, I'll go through um some difficulties that people might have. So if you have difficulty with standing in the shower for a long period of time and you feel quite tired, something called a shower chair, which is this chair here, and or a shower stool can be really useful. It just sits in the shower, and you can sit down while you're doing some aspects of showering, like washing your hair, if you feel like you need to sit down to do that, even to like maintain your balance, or if you feel that you just need a rest while you're showering. They're really useful to help you to manage your energy and just increase your safety when you're showering. Um, then we also have, so if you have a bath and you're finding it difficult to get in and out of your bath, there's lots of different pieces of equipment that can help with that. So the piece of equipment with the blue handle. That's called a bath transfer board. So that just fits over the bath, and then you just sit on that and swing your legs in. So it's just to make it easier for you to get your legs in and out of the bath, because some people find it a bit hard to do that when they're standing up. So this just helps to make that easier for you getting in and out of the bath. Then there's also some bath steps, which you just put beside the bath, and then you can just step up onto them to help lift your legs into the bath to make that easier if you find that it's too high, the height of the bath to help you to get your legs in and out. Yeah, and then we also have some hygiene aids. So if you have difficulty with reaching your back to wash your back in the shower and the bath. There's lots of long handle aids that can help with this. So the one that we have pictured here is a long handle sponge. So it just helps with reaching behind to wash your back while you're in the shower. Then also we have a bottom wiper. Um, which basically it grabs the toilet paper, and if you have difficulty reaching behind to wipe yourself after toileting, that piece of equipment can help with that and make it a little bit easier for you. There's also things called urinal bottles, which people can use if, for example, you get up quite regularly at night time to use the toilet, and your toilet is a long distance from your bedroom. You could have like a urinal bottle beside your bed, which you could use overnight, and then you'd empty it in the morning. Yep. And then there's lots of different pieces of kitchen equipment which can help with lots of different activities or tasks when you're in the kitchen and cooking meals. So I'll go through some of the pieces of equipment that is available. So a lot of people find it quite difficult to open up cans or open up jars because of their reduced kind of strength in their hands. So there is things available that are electric jar openers. So it just sits on top of the jar and then it helps. Basically, it is meant to electronically remove the lid off a jar. And then there also is like can openers as well, which get basically the lift up the can and open the can for you. There's lots of different types of chopping boards available to help with chopping vegetables or buttering toast. So for example, there's one here with the vegetables. If you have reduced, like you have one hand is weaker than the other, and you find it difficult to hold to stabilize a piece of vegetables and also cut it at the same time. There is this chopping board here would help hold the vegetable in place, and then you can just the vegetable chop the vegetable up. So that one's really helpful. There is also if you find it quite difficult to lift up a heavy kettle, especially when it has boiling water in it and it can be a bit unsafe, there is a piece of equipment called a kettle tipper, which just all you don't have to lift the kettle out of the stand. You literally just tip it, and it doesn't require as much strength as lifting up the kettle. And it also is better for your safety, as you're not lifting up a kettle with boiling hot water. Um, for some people, they might find it quite difficult to stand for long periods while they're cooking, especially people find it quite difficult to stand and chop vegetables, and they can get quite tired after that. So this small seat here is called a perching stool, and it's just to place in your kitchen to allow you to perch. And then you can stay at your like countertop and chop up some vegetables, and it just makes not as the task not as tiring. Something I like to also tell people is to sit at their kitchen table and cut up their vegetables sitting at the table, and that kind of works well as well to kind of help with your when not feeling so tired while you're doing that task. Um, then also is something called a kitchen trolley. So, for example, if you're making a cup of tea in your kitchen, but you like to bring it through to your living room, but you're using a walker, or you find it difficult to hold the cup and bring it through to your living room, this trolley here called the kitchen trolley, you can just place your cup of tea or your dinner on the trays, and then use that as like a walker and bring it in through to your living room. So that's a really good piece of equipment to bring uh, meals through to different rooms. Um, Fine. And then for a big part of my role is to give advice on how to prevent falls and how to increase people's fall safety in the home. So there's pieces of equipment that can help with this. So, for example, there is piece of equipment called a personal alarm or a falls alarm, and you can get them in a watch style or ones that you can wear around your neck. And what they basically do is if you have a fall and you're not able to get up to reach a phone, you should be able to press a button on the watch or on the one that you wear around your neck, and then it should alert either like your family members to let them know that you've had a fall and you're unable to get yourself up. So that just it doesn't prevent falls, but it just increases your safety if you do have a fall. As if people have a fall and they're not able to get up, they're at increased risk of being on the floor for long periods of time, which is not good. So this will hopefully prevent that, and that they can alert somebody that they need help. Also, another thing throughout the home that people can get to prevent falls are things like non-slip mats. So these are great to have in like the bathroom, because sometimes when I go in to see people in their own homes, they have mats at the shower, but they aren't non-slip, so they can cause a bit of a trip hazard and a falls risk. So just make sure that if you do have any kind of those bath mats, that they are secure to the floor. They don't increase your risk of falls, and they're just quite stable on the floor so that you don't trip on them or slip on them, which could cause a fall and cause an injury. Yeah, and just some general advice just with falls and preventing falls at home, just to make sure that there's not loads of like carpets with like increased that are quite like thick on the floor that you could trip over, and just make sure that there's nice clear kind of walkways and there's nothing that can cause you to fall. For like wires from like TVs or any pieces of equipment like a lamp, just make sure that they are like tucked away and they're not in the middle of the floor, which you may cause a fall. So just things like that is important to try and increase your safety and prevent your falls at home. Um, yeah, perfect. So then we'll go on to some equipment for chairs and seatings. So for example, if you're finding it difficult to get on and off a chair because you feel that the chair is quite low, there is pieces of equipment, these grey things here, which are called chair raisers. And they just fit underneath the chair and just increase the casters on the chair, and they just increase the height of the chair to make it a little bit easier for you to get on and off the chair. There is also height adjustable chairs, which you can increase the height of them to make them higher and make it easier for you to get on and off the chair as well. And then, so memory aids, there's lots of different pieces of a kind of equipment that can help with your memory. So, for example, if you're not remembering to take your medication all the time, there are things available called pillbox reminders, and it would set once you can set it to a certain time that you need to take your medication, and an alarm will go off to let you know that you need to take your medication. There is pieces of equipment called automatic stove switch off timers. So if you leave your stove on by accident for a long time, it will basically automatically switch it off for you so that it won't cause any risks. Um, there is loads of other just pieces of some tips that I can just give you guys just to remember things. So, always keeping like a calendar, even putting it on your fridge or having a diary to write down all your appointments so that you don't forget them. Having timers. So if you know, need to do something at a certain time, putting on a timer to remember it. Having kind of visual stuff in the house or like post-it notes, just stick it on like some of the cupboards or anything like that for things that you need to remember. Like for example, if you kind of forget where things are, like in your cupboards, like if you have glasses in them or that kind of thing, if you just put post-it notes on the door to remember what's in them, that can be quite helpful. And yeah, just using kind of things like that to help you to remember certain things in the home. Um, so perfect. So what's next? So normally what happens is an occupational therapist like myself would come out to your house and we would look at how you move within your home. We would have a chat about the difficulties that you have at the moment, and we would make kind of recommendations for equipment that would help you to achieve your goals and make tasks easier and increase your independence at home. And then we would speak to a case manager about the recommendations, and then we would provide the equipment. Um, and just to let everyone know that next week, we have another webinar on Wednesday, with our speech pathologist on swallowing, on mealtime tips, if anyone would like to join. Perfect. Does anyone have any questions? I think there is some in the chat, so I will go through them. So somebody asked, can I just go out and buy this equipment myself? So for some of like the low cost equipment, like the things in the kitchen, like the jar openers or yeah, things like that, or the can openers, you can just go out and buy them yourself. But things that are a bit more like more higher cost, or um things like the kitchen trolley and that kind of stuff, I would always recommend for an occupational therapist to do an assessment and make a recommendation, because they can make sure that it suits your needs, and that they're appropriate for you. And yeah, things like the things for the toilet or the shower, you can buy them yourself, but I always recommend for an occupational therapist to do an assessment just to make sure that it fits your like measurements, and it fits in the house and it can be used safely in the home. And then somebody asked, will these equipment be purchased through home care package? Yeah, so depending on the level that you're on with home care package, what normally happens is the occupational therapist will go out and do an assessment. They will make recommendations on what type of equipment would be suitable for the person. Depending what type of equipment it is, the occupational therapist might do a trial of the equipment to make sure that it's suitable for the person, and then they'd make their recommendations to the case manager, and then the case manager would purchase it through their home care package funding. Um, and then somebody asked, how often should aids be scheduled for review, and who reviews and assesses the aids? So the equipment should be depending, it really depends what it is, and it depends on the person's needs. So some pieces of equipment needs to be reviewed quite regularly by an occupational therapist. But if it is something like a low cost bit of equipment like the jar openers or can openers, that doesn't need to be reviewed by an occupational therapist. Um, but yeah, if someone's needs kind of change quite regularly, then it should be reviewed every 3 to 6 months by an occupational therapist. Um, okay, and then somebody else asked, can OT be delivered by telehealth? So yeah, occupational therapy can be delivered by telehealth, but it is mainly for pieces of equipment. If it's for equipment, it would be for pieces of equipment that are low cost, and things that are kind of um, you can easily provide. So things like any of the kitchen aids, like a falls alarm or personal alarm, all of that can be provided through telehealth. And then Casey asked, does NDIS or home care package cover automatic stove switch off timers? So I'm not 100% sure about NDIS, but with home care package, yeah, depending on the person's funding, and if the recommendation is made by the occupational therapist, then they can fund the automatic switch off timers. Yeah, as long as the OT makes that recommendation, and it is appropriate for the person. And then Nicole asks, will you be uploading this webinar somewhere so we can access it later? I think this should be uploaded to YouTube, but Nicole can confirm if that's gonna happen. I'm not too sure.
Yeah, that's right. Spot on.
Yeah, perfect. So this will be uploaded to YouTube afterwards for you to access whenever. Okay. And then somebody asked, can I please ask about the fee of OT assessment for approval of these equipment? How is the fee processing between the assessment and the equipment from Empower Healthcare? Okay. Yes. So, Nicole, do you want to answer that, or?
It actually goes through your provider. So if you've got a home care provider or a CHISP provider, they will actually refer to us, and then we will invoice through them, and they will take it off your CHISP or home care package or NDIS package or whatever you're on. And if you're paying privately, you would actually pay directly to Empower Healthcare. So we would invoice you directly. So hopefully that answered the question.
Perfect. Thank you. Um, and yeah, I think that's all the questions so far. So yeah, if there's no more questions, thank you all for attending today. And if you want to go back and look at the webinar, it will be uploaded to YouTube. Okay. Thank you for coming. Bye.